Hello, my name is Austin, and I'm going to be the pharmacist working today. My technician told me that you have some questions about your insurance plan, specifically the cost.
Yes. I don't understand why my copay is so high when I already pay my insurance company every month.
Would you like to know more about your insurance, specifically the cost? Would you like me to explain in more in depth, like the deductible, premium, the copay, or co-insurance, stuff like that?
Yes, please.
Well, the premium, again, is the cost that you pay the insurer per month. So that's just the normal cost that you pay every month. I mean, I'm sure you already paid it because it's past January 1st. And the deductible is a set fee that you pay at the first time you use your insurance for that year. So as an example, let's say that it's the first time you're picking up your prescription for the year. And let's say it's January 2nd, which is today's date. And well, you pick up your prescription and you realize that it's going to cost a lot more than it usually does, and that's because you have to pay a deductible before you actually pay for your prescription. So once you pay all that off, the deductible, which is set by your insurance company, then you will just pay the regular copay.
Okay.
So do you understand what the copay is, tiering, and the formulary and star ratings and stuff like that?
No, I don't know what those mean.
Okay, so I'm going to explain those to you quickly.
Okay.
So, a copay is the cost that you have to pay before you pick up your prescription. So, as you're picking it up, it's just going to be $3, $4, anything like that. It's not the deductible, it's just what you owe because the insurance already paid for most of it. They just left you with a certain amount at the end. So, they pay, let's say it's $100. Insurance company decides to pay $97 for the prescription, you pay $3. So, you just have to cover the remainder of the cost. Tiering stands for there's certain categories that the insurance company puts or associates drugs in. So let's say that the Lipitor that you have for certain insurances, it might be a tier 3 or a tier 4. Another example would be Sovaldi, hepatitis C medication. That would be a tier 5 because it has a high cost and therefore it's associated in that category. Formulary is a term that is used by insurance companies to explain to their customers that a drug is or is not covered. For example, something that is on formulary means that it is covered by the insurance company. When it says that it is not on formulary, that means that it is not covered by the insurance company.
Okay.
Again, when it says it's on formulary, they could cover the full cost, they could cover most of the cost. For example, just like that example I just explained with the $97 versus the $3, it is on formulary. That Lipitor, for that example, was on formulary. They paid $97, you paid $3. If it wasn't not on formulary, you would pay $100 total.
Okay.
So the star rating is defined as the rating for the insurance company in that specific area based on cost and many other factors, such as the deductible, copay, premium, stuff like that, and affordability. So you really want something that has the higher star rating. It also has to do with the amount of medical attention that you need. So the higher the star rating, the better medical attention you will get. But that usually also, most of the time, requires a higher premium to be paid beforehand. Can you please repeat some of that information back to me?
So the star rating, you want the higher star rating, that's probably a better insurance company with better coverage. The premium is what I pay per month to have health insurance. The deductible is money that I have to pay when I start using my health insurance, and then once I pay the full amount, then my insurance company will start paying bills, not any kind of payments. Formulary is the drugs that are covered if it's on formulary. If it's not on formulary, then those drugs won't be covered by my health insurance. Did I miss any of the other ones?
No. And looking at the prescription that we do have here in front of us, again, I do realize that the price is kind of high, and that is most likely the reason. You might be thinking that it could be the deductible is the reason why. You actually don't have a deductible for this insurance company, for your AARP Medicare. You don't have a deductible. You actually have a copay. And AARP doesn't actually fully cover Lipitor. So I would actually recommend you to either contact your doctor, or I can actually contact your doctor to see if we can switch your Lipitor to the generic, because Lipitor is the brand. Again, usually brand costs more money because the company that actually produces the drugs, over a long period of time, they spend billions of dollars, and they usually have their own brand of the drug, which costs more in order for them to make that money back.
Mm-hmm.
So we could switch you to atorvastatin, which is the same exact drug, just the generic brand, just the generic, and it's going to cost less overall. So again, you're going to pay less for your prescription instead of more.
So will it do like the same thing?
It will do the exact same thing. There should not be any difference between the two. It's just it's just the name. Name and cost are the two main factors with the difference between the two.
Okay.
So again, I could contact your doctor. Would you like me to do that?
Yes, please.
All right, I'll go do that. Okay.
Thank you.
I'll call you when the doctor responds. Okay, or you can actually come back later on, or I can give you a call when the doctor actually calls me back. I'll just look up your number right here.
Mm-hmm.
I'll give you a call, and then you can come pick up your new prescription. Okay.
Okay. Thank you so much.
You're welcome. Have a nice day.
You too.